to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're talking about a topic that's difficult, but incredibly important: medical errors. Most people don't think about medical errors until something happens to them or someone they love. One moment, you trust everything is moving forward safely, and then the next you're left asking, how was this missed? How did this happen? These experiences can be frightening, frustrating, and deeply emotional. So today we're asking an important question. What are we doing about medical errors, and how can we reduce risk moving forward? So joining me today is Christine, a member of our team. Hi, Christine. How are you?
I'm great. Thank you so much for having me again here, Dr. Borelli.
Of course.
Yeah, so let's start with the basics. What exactly are medical errors? For sure, knows what medical error is, but not entirely sure like the in-depth explanation of what it is, right? So why do they happen?
So medical errors can occur for many reasons. Healthcare today is incredibly complex, and there are multiple providers, medication changes, test results, handoffs between departments, and electronic systems involved. So sometimes errors happen because of miscommunication, incomplete information, medication mix-ups, breakdowns in coordination between providers. I mean, there's so many reasons. It's really important to say this clearly. Most healthcare professionals are dedicated and working hard to provide safe care, and not every poor outcome is a medical error. But when errors do occur, they can have serious physical and emotional consequences. It's often an error in the system and not like one specific person.
Right. And healthcare organizations use safety initiatives and quality improvement programs, right? So why do patients still feel, uneasy? And if systems exist, why do patients still feel vulnerable?
Well, because even with safety systems in place, healthcare can feel rushed and overwhelming. Appointments are often short, information can be dense, patients may not know what questions to ask, and when someone is sick or under stress, it's even harder to track details or notice when something doesn't feel right. So many patients tell us that they worry about missing information or missing something: a medication change, a test result, or a misunderstanding between providers. And those concerns are very valid.
Right. Right. And you mentioned that patients also play a role in a safer care. So what role do patients play in reducing, medical errors?
So, reducing medical errors is a shared effort. Healthcare teams continue working to improve systems, but patients who are informed and supported are better positioned to ask clarifying questions, confirm medication lists, understand instructions, and speak up when something feels unclear. So, awareness, communication, advocacy, those are all essential components of safer healthcare. So, patients should never feel afraid to ask for clarification. That's not being difficult, that's being engaged in your care, and everyone should do it. I encourage everyone to do that.
I agree with you. And this seems like an area where a private patient advocacy can make a significant difference, right? So how does private patient advocate help reduce this medical error risk?
So it absolutely can make a difference, I think it does. One of the most effective ways to reduce risk is having someone focused on the bigger picture of your care. At Pathway Patient Advocates, we help our patients stay organized, informed, and prepared, all of which reduce the likelihood of miscommunication and overlooked details. An experienced private patient advocate can do many things, including advocate for you in and out of the hospital, discuss concerns and recommendations with your care team, organize medical records and medication lists, prepare focused questions before appointments, help clarify treatment plans and instructions, support communication between multiple providers, encourage patients to speak up when something feels unclear, and keep families informed during complex situations. So that added layer of coordination can make patients feel safer and more confident.
Right. So ultimately, what does safer healthcare look like? So how do we move toward safer healthcare together?
So it looks like partnership. It means healthcare teams continue to strengthen safety systems and patients feel informed, heard, and supported enough to actively participate in their care. So no system is perfect. I mean, I think we all know that. But when patients feel prepared and protected, they are better positioned to help catch potential issues early. And that collaborative approach makes a huge, real difference.
I absolutely agree with you. And no one should leave a healthcare experience replaying conversations and asking, like, how did this happen? Right?
Exactly. Every patient deserves to feel heard, prepared, and safe, knowing someone is truly in their corner. At Pathway Patient Advocates, we believe private patient advocacy adds clarity, coordination, and confidence to these complex healthcare journeys. If you're concerned about safety, communication gaps, or navigating complicated care, you don't have to manage it alone. Because safer healthcare isn't just about systems, it's about support.
I love that. Well, for anyone looking for help for themselves or for their loved ones, there are so many ways to reach out to us. You can visit our website at pathwaypa.com.
Thank you, Christine. It's been a pleasure, as always. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journey. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.